Hello everyone, I'm Dr. Prateek Joshi. Today we have a case of a posterior root medial meniscus complete tear in a young individual. You can see on the diagnostic arthroscopy the medial compartment looks to be quite good. There isn't much sign of osteoarthritis. So you must repair this kind of medial meniscus posterior root tear, because if we don't repair this kind of tears, this patient will have medial compartment osteoarthritis in next few years. So by repairing this meniscus, we are going to prevent the progression of osteoarthritic process in this patient's knee joint. So you can see that I am using arthroscopic probe to inspect the tear that we are having, and I am also trying to see whether there is any additional tear in the substance of the medial meniscus, because if it is there, then we need to repair that too. So now we have a specialized low profile jig to drill guide wire through the tibia in order to create a tunnel inside tibia. We have to be very careful not to overshoot our guide wire, because there are important neurovascular structures just posterior to this region. So now my assistant is drilling over the guide wire with end over turn drill bit, and I am protecting the guide wire with the help of a scoop, and this is going to prevent further progression of the guide wire while drilling. So our tunnel is ready. Now we are going to pass the sutures through the tunnel. So these sutures are going to be used to shuttle our meniscus repair sutures through the tibial tunnel. So now I have introduced my suture passing device through the anteromedial portal, and I am passing the suture through the substance of the posterior root of the medial meniscus. This is a tricky maneuver because the space is very limited, and we have to be very careful not to damage the articular structure as well as not to damage the instrument, because if the care is not taken, the instrument can also break inside the joint. So now we have taken one cinch stitch through the substance of the posterior root of the medial meniscus. Now we are going to introduce our suture passer again, and we are going to take another bite through the substance of the medial meniscus posterior root. Again, we have to be very careful while passing this device through the joint, because there are some sutures lying there, and we don't want any entanglement of the sutures with the instrument. And again, as you can see, we could take a good bite through the substance of the posterior root of the medial meniscus, and again we are going to create a cinch stitch through this suture. So now we have two bites through the substance of the medial meniscus posterior root. They are very strong and there is very less chance of cut through. And now I am going to shuttle my both the sutures with the help of a shuttling suture loop to pass the sutures through the tunnel of the tibia that we had created earlier. So now both the sutures are in the tunnel, and I am pulling the sutures to confirm the position of the posterior root of the medial meniscus. So this is the final picture after we have tied our sutures on the suture post. You can see that the posterior root of the medial meniscus is sitting nicely on its footprint and it's quite strong. The configuration of the repair is acceptable. We are going to make the patient non-weight bearing for 1 month duration, after which we are going to allow full weight bearing gradually. Thank you for watching this video.